This is Q13 News at 5.
Good. All right, so kids are back in school, and there are lots of things that are on the minds of families right now. Coming up in studio, we're going to talk to a doctor live about some of the things that may be on your mind, including the flu, vaccines, and anxiety with kids heading back to class. That's next. Well, now that the kids are back in school and the weather's starting to change, there's a lot to talk about and probably a lot on your mind. So joining me now is Dr. Ari Gilmore from PacMed's Beacon Hill Clinic. We have a lot to cover here, so let's get started. Back to school. I have a question from a viewer, actually. His name's Jeff, and wants to know about anxiety for parents and kids. Starting a new school, finding your locker, the anxiety of homework. How do we broach this subject with our kids and deal with it?
I think it's really important for parents to figure out if their anxiety is really theirs from their memories and separate it from their kids and look to their kids to see if they're bringing that home with them.
What advice do you have then if you start noticing that maybe somebody is a little more stressed than normal?
Yeah, well, it's really important to hit the basics, making sure they're getting enough sleep, they're eating properly, being sent off to school with enough time to be ready. Simple things you can tell them about looking other kids in the eyes, and then normalizing it, acknowledging it, saying anxiety is something we feel, and it can help us be ready, but it's not something you have to be scared of, and to plan for it. So setting up situations where you say, you know, if this happens, what are you going to do when you feel those, rather than trying to just assure them it'll be okay, because that doesn't acknowledge their actual feelings.
Yeah, be open about it, and it's really common. So vaccines, there are some changes this year we need to know about. What are they?
This year there's no flu mist, so that's a big change. All those kids who are getting the ouchless flu vaccine are going to be very disappointed.
Why is that? Why don't we have the flu mist?
It wasn't as effective as initially we thought it would be. So over time, it really wasn't doing its job.
Kids are going to be bummed out about that. You got to get the shot this year, but it's for the best. Let's talk about flu season. Do we know yet how bad it's going to be?
No, it really takes time to see what strains come over, the virulence patterns, and then how this year's flu vaccine is going to work for it. Initially, I've heard it's hopefully 60+%, which is a pretty good odd. I'm going to definitely get mine.
And you said your clinic's starting to get the shots in, so we should see that roll out pretty soon?
Yeah, I'm seeing it at different pharmacies, and then a lot of clinics have their flu shot clinics where people can just line up and get it over with on the weekends. That should be happening in the coming weeks.
Yeah, got to get out there and get it. Let's talk about college students for a moment, because they're heading back to school as well. They deal with anxiety, but some also very serious issues, including one is binge drinking. What do you want people, parents and kids going off to school, to know about that problem?
Yeah, for binge drinking, it really is an issue, and I think it's important to be clear with kids, your expectations and what you hope for them. So simple statements like, I hope you don't, drink. I know most people end up at school, and so if you do, these are some parameters. Number one, developmentally, your brain until you're 25 isn't set up to handle things well. So when you binge drink, you really are changing that elastic growing brain in ways that can cause more of a problem, and a repetitive binge drinking obviously is what we really worry about. Telling them simple clues about how to be safe, not letting not losing sight of their drinks, keeping with a group of friends, kind of setting an idea ahead of time on when they might stop, and then having that no fault. If you give me a call, I'm always there to help you. Or if you're on campus, utilize some of the free services to get yourself back home and safe.
Oh, it's such good advice. Being proactive, making sure you keep that line of communication open. We covered a lot. Thank you, Dr. Ari Gilmore, for being here with PacMed. I appreciate your time.
All right. Thank you for having us.
Matt.
Important topics for a whole lot of families.